I am Erika Olson. I work for Impact Incorporated. I'm the Coordinated Entry Manager. I've been in this work for about 4 years. And then prior to that, my experiences in early childhood development and education. So really started out my career in Coordinated Entry and then have sort of been there to facilitate trainings on it and educate people on it for a little bit of time. So you may have interacted with me in other spaces or you might have had your own Coordinated Entry training. We're going to be doing sort of a high level about what it's like and a little bit of the implementation and what it looks like in Milwaukee today. So first off, to start out, what is this and why do we have to do it? I can hear you now, this is yet another thing, another process, something else that we have to interact with. And we're already fairly overburdened as service providers and advocates who connect people to resources. But this is a HUD mandated process. And what we are mandated to do is identify, assess, prioritize, and refer into homeless services. So every community that has homeless serving agencies is going to have a coordinated entry system, and the application of it does look different depending on the community that you're in. So for instance, the Waukesha community is going to have potentially a different application of coordinated entry with the same core necessities, but just different sort of ways that it's implemented. HUD recognizes that each community is different and has different resources, and so the application is going to look a little bit different in each community. We have expertise on what it looks like in the Milwaukee community, so we'll be focusing very heavily on that today. But if you do need connections to outside counties, please feel free to let us know, and then we can try to get you looped in with the correct coordinated entry process with the person that you're working with. It's also mandated that all funding through the Continuum of Care and ESG are required to go through coordinated entry. So it is necessary that placement into these programs comes through our process. And we'll go into it a little bit on what these different aspects of this process means and what we need to do. A little bit of vocabulary to start us out. We'll be talking about these terms throughout as well, but there's different categories of homelessness defined by HUD. Why this matters is because different people in different situations qualify for different types of funding. So there's the necessity that certain programs have people referred to it that are experiencing Category 1 homelessness. Category 1 homelessness is those that are literally homeless, so people who are staying in a place not meant for human habitation. So we get a lot of calls where people are staying in a car, in a storage unit, in a park, things like that. As well as people who are staying in emergency shelter or safe haven, they also qualify as Category 1 homeless. And so there are particular funding sources that are geared directly toward that population. We also work really heavily with those experiencing Category 2 homelessness, which is those at risk of literal homelessness. Most frequently, we see people who are doubled up with friends or family and at risk of having to leave. So there has to be, by the HUD guidelines, within a 14-day window that person would have to leave. So if you have a person that's doubled up, but they can stay for a few months, they would not qualify as Category 2 homeless. This population also includes people who are experiencing an eviction and being asked to leave within 14 days. So that's a really heavy population that we're working with. Most of the people that we are working with fall within those Category 1 and Category 2 guidelines. There's also Category 3, which is unaccompanied youth, and there is no timeline for when that youth might have to leave. So for Category 2, there's that 14-day window, but there isn't that for Category 3. We see that a little bit less frequently, but why it matters so much is because there are particular funding sources for that population as well. Those experiencing Category 4 homelessness is those fleeing violence, whether that's intimate partner violence or other types of violence. HUD recognizes that sometimes it's more dangerous to stay inside somewhere as opposed to staying outside somewhere. And there are specific funding sources and systems in place for those experiencing Category 4 homelessness as well. Some other key terms that we'll talk about a little bit throughout this presentation. Rapid rehousing is a HUD style of housing assistance, which is about 12 to 24 months of rental support with light touch case management. We like to think of it as a style of housing assistance. So there's many different rapid rehousing programs within our system. And so there are going to be different applications of that rapid rehousing program depending on the community and agency that you're in. All rapid rehousing placement is mandated to come through coordinated entry. And so a referral into coordinated entry automatically makes it so that that person is in the running for all things that they qualify for, including all the rapid rehousing program that we have in our system. Permanent supportive housing is another HUD style of housing assistance that is lifetime. And it is permanent. It is more intensive support from case management. And our community right now is prioritizing people experiencing chronic homelessness for permanent supportive housing. And our hope is that we eventually get down further on the levels of criteria and prioritization so that we can use permanent supportive housing for other populations as well. But right now, that's what we're prioritizing it for. There's different types of permanent supportive housing. And so if you're interested in hearing all about PSH, feel free to let me know and we can have a deeper conversation about that. We also have homelessness prevention resources within our system, which is targeted towards people experiencing Category 2 homelessness. And that's the hope is to help someone launch into their own apartment prior to entering into the homeless service system and the shelter system at all, if at all possible. I'll pause there for questions. Are there any questions so far as we've been going through? I'll open the chat as well.
Hey, I was just wondering if we were interested in learning, like you said, about more PSH. Is that something that we would email you about, or?
Absolutely, yeah. Feel free to email me about it, and we can have a deeper conversation about that. I think the people are let in the lobby, and then, yeah. Any other questions about coordinated entry that people have?
Is rapid rehousing and permanent supportive housing a certain population only, like families or is
That's a
it
good
anybody?
question. Yeah, that's a good question. So rapid rehousing, there are different rapid rehousing programs targeted to different populations. So there are certain rapid rehousing programs that are purely for families and some that are purely for singles, things like that. And permanent supportive housing as well does have that separation. So there are different programs targeted for different subpopulations. Generally, it's just that rapid rehousing and PSH are styles of housing assistance. And so that's just very general, I guess, definition of what those mean and how they apply. That's a good question. Okay. We will keep on moving then, but keep the questions.
I just had a quick question about, would transitional living fall under the rapid rehousing category?
No, so transitional housing is a place for a person to be in between like an emergency shelter and their permanent housing destination. So transitional housing is not considered permanent housing. And HUD has sort of moved away from funding those types of projects as well, as they're called transitional housing. But we can have a deeper conversation too about that. But that's a good question. They would not qualify as permanent housing.
Does it fall under the coordinated entry system?
Sometimes, not always though. So yeah, we can have a deeper conversation too about that.
I'm gonna need a one-on-one with you.
Excellent, that sounds great. I look forward to that.
Okay, thanks.
No problem. Yeah. Okay, so talking a little bit about our work before coordinated entry. So coordinated entry didn't always exist. Before it was fairly first come, first serve. So the people with the quickest dialing fingers who called every shelter first thing in the morning and had a person with the lowest acuity was there to sort of receive shelter and housing resources first. It was fairly relational. We had, if a case manager had the best relationship with someone who was working at a particular housing project, would receive resources. There were fewer objective measures of vulnerability that our system has been able to put in place, and we were missing our most vulnerable. So we would have people that, have mental health behaviors and make it difficult to persist in sort of a shelter environment. And it was hard to prioritize those individuals because those behaviors made it difficult for them to persist in that environment. And so HUD decided that every system needs to have a coordinated entry system because we need to have a more equitable way to distribute resources. So that was why it was implemented in this community and every community. We know that having a centralized entry point for prioritization makes our services more equitably distributed. So I always say, I hope to work ourselves out of a job. I hope that there is so much housing resource and so much out there that we don't need to prioritize, but we are not there yet. We know that the need far outstrips the existing resources, and because of that, we need to exist because we need to make sure that the most vulnerable person today receives the resource first. And that can be a really painful conversation and can be very painful when you have a person in front of you that clearly needs assistance and clearly needs a resource, but it could be that they are not the most vulnerable person today. So we'll just keep that in mind as we keep going on that. We also have sort of relatively new to our system is the homelessness prevention work that our system has been able to put in place. So prior to the existence of homelessness prevention programming, it was believed that all interventions began with emergency shelter. So we were only really able to serve those experiencing Category 1 homelessness. A person entered into emergency shelter, met certain criteria, and were deemed ready to exit to a transitional housing destination. And then they met criteria there, and then they were deemed ready to move into a permanent housing destination. There were all these potential fall points, and the housing readiness model that we were using was very heavy. It was difficult for people to then succeed, and it also set the tone that we needed to get people into shelter to access any type of housing resource. Homelessness prevention in its existence sort of bucks that, and the hope is to be able to work with and serve people prior to entering into the shelter system as well. And while we know shelter may be a part of a person's journey, we know that it is more fiscally responsible and less traumatic to prevent homelessness in the first place. So I don't know that we'll ever get to a world where emergency shelter will not need to exist. It may be a part of someone's journey. There are emergent situations where a person needs this type of resource, but we know that, again, not all interventions need to begin with emergency shelter because we can start with homelessness prevention first. And we have a whole host of prevention resources within our system now that can serve different populations. And so we are a lot better resource as a system to be able to work towards preventing homelessness if we can, prior to someone experiencing that type of disruption. We'll pause again for questions. Any questions so far?
There's
Got a couple in the chat.
Open the chat. Thank you. Okay, so let's see. When consumers call coordinated entry, can and should they ask for specific housing programs like City Section 8 versus County Section 8? They absolutely can. We want to help people get the resource that they want as much as we possibly can. But what's difficult is that what a person wants might not necessarily be what they qualify for at the time. And so what we're doing when we're interacting with people is performing an assessment and putting them in the running for everything that they potentially qualify for, including those types of programming. But sometimes we have those situations where someone is calling in and they're like, I would like rapid rehousing. I would like rapid rehousing, but they might not qualify for it at that time. So a lot of our conversations sometimes center around, you might not qualify for that, but let's try to get you in the running for everything that you do qualify for. And let's work towards a triage plan right now that we can.
He canceled it.
I'm hearing a little bit of feedback, so if you're not talking, then you do. Okay, whose role or how is the decision made for which programs consumers are placed into? That's an excellent question, and we will definitely get into that. So there are staffings that we will talk about in a little bit, but the prioritization criteria is determined by a group that is made up of emergency shelters, housing providers, people with lived experience. So it's not just our team that determines that prioritization criteria. The phone number to dial in for audio. I don't know, Greg, if you could take a look into that for helping someone out with that IT question. Yeah, thank you, Dina. I saw that in the chat too as well, that you were putting that in there. Any other questions while we're paused? Can you appeal the decision? So yes, we can bring it to a staffing and talk through, what other subjective criteria and things that might, if we weren't able to prioritize someone for an emergency shelter bed, we can bring that forward. And then there's also coordinated entry leadership that oversees our work. And so things can be brought to that space as well if there is conflict about a decision that was made. It's a good question. Okay, we'll keep moving then. Okay, so how does this work? I always like to think of how we operate sort of this hourglass shape. So up at the top of the hourglass, we have our partnership with our 211 call center, and they take calls for housing and healthcare and food and clothing and all these other resources. And so by calling 211, that's always an option for people to get to our team. There's also other ways that people interact with our team. So a little bit further down in the center of that hourglass is the coordinated entry system, where we're there to do that assessment and triage, and then refer out into sort of the bottom part of the hourglass into resources that person potentially qualifies for. So again, you can see what we're mandated to do. We're mandated to identify, assess, prioritize, and refer into resources. There's lots of ways that people might be identified as needing services. A person might call 211. They might self-identify as in need of housing resources. We might receive a referral in from a different professional. So we have our phone professionals line that healthcare systems and other professionals call into. We receive email referrals from partners. We might have a person come to one of our in-reach sites where we do in-person assessments, or we might have a person that connects with our outreach teams that go out overnight to connect with people who are staying outside. And so referrals come in from lots of different places into the centralized entry point for prioritization. And you might be instrumental in helping us with this step. I always say that we can't do the work that we do without the help of our partners. You are interacting with people that we don't know about. And so you sending a referral in really, really helps us with this identification process and knowing the full picture of people experiencing homelessness within our system. So after that identification piece comes the assessment phase. So our team is performing an assessment based on what that person is disclosing of their current situation. So it might be that they are doubled up. We might be doing a category 2 assessment. We might be doing a category 1 assessment. The vulnerability screen that we use to help us with our objective criteria is the Vulnerability Index Service Provision Decision Assistance Tool, which is just a really short name and just rolls off the tongue. But this is a vulnerability assessment that we're using to help us have an objective measure to compare and use that within our staffings. It's not the only measure. There are some communities where that assessment criteria matters the most, but we have utilized a system where we're taking into account the objective and subjective criteria. After that assessment piece, so we're gathering information about that person, we're doing some light triage, and then it moves towards the prioritization process. So we use what happens in that assessment to prioritize for resources, including emergency shelter and housing openings. We also then, after that, refer. So the prioritization happens, there's a staffing, and then there's a referral out to either a shelter or housing program or a homelessness prevention program. We're there for the completion of that referral. And then there's times where someone is in a housing program, they are not happy with that situation, they would like to move to a different one. And so for that, we do a transfer process where a person can, elect that they would like a different housing option. They want something that's has a little bit more support, a little bit less support. Our hope is that we are placing people into housing of their choice and allowing people to have that sort of self-identification of what it is they want and what resource is best for them, because that person is the expert on their own life. So again, this is how people are sort of moving through these mandates that we have as a coordinated entry system. All right, so we had a question about prioritization and the staffings. So a staffing is essentially an interagency meeting where we talk through and slot for housing openings and vacancies that exist. So these are the prioritization criteria that we have for different subpopulations. Again, these were worked out by continuum of care groups. And so, for instance, for families, a group got together, including, Milwaukee Public Schools and DMCPS and people with lived experience and housing providers and shelter providers got together and talked through what would make a family more vulnerable and in need of housing assistance first. So we know that a family who has more children, it's going to be more difficult for them to be able to find a 5-bedroom apartment versus finding a 2-bedroom apartment. And so we know that those with large families should be part of the prioritization criteria, things like that. So groups got together and talked through these prioritization criteria. If you have feedback or concerns about the prioritization criteria, you can let me know, and we will bring that to coordinated entry leadership, which helps us to oversee our work, and we can make changes in that space too. So for emergency shelter, we prioritize those staying outside. Second, those fleeing violence. Third, those leaving an institution, and then fourth, everyone else. So it's not the case that there would never be someone entering in from a category 2 situation. It's just going to be very difficult to prioritize someone staying in a category 2 situation because we have so many people staying outside. And these are the criteria. There's always some exceptions to these rules and these guidelines. So we might have someone that is fleeing a very violent incident, and we decide collectively on that staffing that person needs to be prioritized over other people that are staying outside. So we take the objective of that assessment and the subjective about what you know about that person and bring that forward to the staffing. The prevention staffing, we're utilizing right now a prevention assessment score, but we're working towards different prioritization criteria and a Q-based report and some other things because I think we're just grasping as a system what makes someone vulnerable in a prevention type way. For rapid rehousing, for singles, the prioritization criteria is returning to homelessness and then the length of time literally homeless. And then for families, again, we prioritize those staying outside, next to those fleeing violence, third, larger families, fourth, those with younger children, and fifth, those with the disabling condition in the household. For permanent supportive housing, once again, we are prioritizing those experiencing chronic homelessness, and then literally homeless with severe service needs, and then finally those with severe service needs. So our hope is to house everyone that's experiencing chronic homelessness in permanent supportive housing, and then be able to move down this other criteria and prioritize others for this housing resource. Again, a coordinated entry staffing is really a interagency meeting that CE facilitates. But we have several activities that happen in these staffings. So first we follow up on previous referrals. We talk about what happened last time. Did they move in? Did they decline that unit? Would they like a different unit? Things like that. We announce existing openings and then sometimes go back to previous referrals that have already happened and potentially offer a different type of housing assistance to someone who had declined a different type of housing. And then we go off the list to fill. We're also then having those case conferencing situations where someone has, a unique situation where they think that that person might need to be prioritized over others from the list. And so we have space for those conversations to happen. Our second intervention meeting is really our transfer and bump up meeting. And so that's there if a person is not satisfied with their existing housing option and want to move to a different one. We then also announce openings there and have some space for case conferencing. The shelter staffing happens daily, and then other types of housing staffings typically happen twice a month based on subpopulation. So we have a family staffing, a veteran staffing. The prevention staffing happens weekly as well on Tuesdays. So that's a lot of what we're doing sort of in the day-to-day to help coordinate and prioritize in those spaces. We talked a little bit about prevention resources before, but there are some homelessness prevention resources that we place into via the weekly prevention staffing. And then there are other resources that are there even before reaching coordinated entry. So there's lots of wonderful places to refer to for people to receive legal resources, income resources prior to engaging with coordinated entry. These are a few examples. This is not comprehensive, but the Rental Housing Resource Center has a wealth of resources and connections to be able to facilitate for some homelessness prevention resources. Mediate Wisconsin is great for mediation between landlords and tenants. We refer out to TV shelters fairly frequently. It is our process to refer out and ensure that DV space is full prior to considering traditional homeless space. And so you might receive feedback from us that we need you to attempt those resources first. W2 has an emergency assistance program that we refer to fairly frequently that can be accessed before coordinated entry. There's income gain resources. And then the MIRA funds with SDC and community advocates is a great resource to attempt as well. And these resources really are to, again, help prevent that homeless and housing crisis before it happens. And so we also have this plus the ones that come through coordinated entry, which is great. And we didn't necessarily have those types of resources in the past. I'll pause there for questions as well. Let me open up the chat and see what we've got. Talked about that one. And then go ahead. I'm sorry.
I apologize, Erica. Were you saying that you were pausing for questions right now?
Of course, yeah.
I do have a bit of a question, and I'm not even sure how to word it. I was sitting here how to try to figure out how to type it in the chat. If you have, I know we deal with a lot of individual cases on a case-by-case situation, but I kind of wanted to throw it out there and ask about when we deal with morbidly obese individuals who are first floor bound and don't feel comfortable with exactly going into a shelter. How do we go about assisting or accommodating those individuals?
Yeah, that's a good question. So when people have mobility concerns or, they need accommodations, whether that's in shelter or in housing, I would say bring that forward to the shelter call as well as the permanent housing call that you are staffing them on. Because we don't want to place someone into an apartment or place where they're not going to be safe and they're not going to have the type of accommodations that they need to be able to be safe in their environment. So we have had situations where a person, says, I need a unit that has doors wide enough for a wheelchair to fit in. And so we say, okay, let's find that. And if we have a unit that doesn't have that, then we are working towards trying to find either a different unit or how can we accommodate in that existing unit so that that person has their needs met. But that's a really good question. Yeah, we would prefer that those things be brought up so that the person doesn't have to, you know, not have their needs met in their housing. See some hands. So it looks like Genesee, yours was first. What's your question?
So on the morbidly obese question, with our prevention program, we do see folks that are morbidly obese or have those really severe mobility issues, and they're seeking prevention assistance. What support is there to assist them in viewing homes? Because we're not able to do that transportation piece, but we're also not viewing apartments on their behalf.
Yeah, I think we've used like medical transport in the past.
Okay.
I've also used like Zoom tours. I know it's not exactly the same, but there are sometimes some video conferencing options that feel appropriate because, yeah, we don't necessarily want a person to have to spend all of their income on trying to get rides to those types of showings. And yeah, I get what you're saying. We're not seeing the apartment for them either, right? Because they're the person that wants to live there and would be living there. So it's not perfect, but those are some resources that we've utilized in the past.
Okay, thank you.
And Deanna, I see your hand up as well.
Hi, Erica.
Hello.
I'm trying to look for the best route for a certain population. So we have people coming out of the hospital with behavioral health and substance use disorder. So the first question I have is, what's the best way to get those folks screened? So like, if they have a lack of phones and things like that, are you able to screen them in the hospital, or is there some way we could get them screened before they're discharged?
Yeah, so we do have a health systems liaison who is there to be our connect between the intersect of healthcare and housing insecurity. And I would say that you and I maybe should meet offline and talk through the best sort of referral pathway. But there are ways that we can interact with that person prior to discharge as well as after. It's more just, when we're identifying them and what resources we have available at the time. But let's connect offline just to talk more specifics. We'd love to connect with you about that.
Okay, and then the second question is, with that type of population where they might be losing their phones or difficult to get in touch with, how long do you leave them on the coordinated entry list before you just delete them or whatever?
Yeah, that's a good question. So we do have a person that's dedicated to reaching out to people that we list them as BOLO, so be on the lookout for. And so we attempt once every 30 days over a 90-day period. And if we don't interact with them, we can take them off of the list. Or if we have no contact fully in one whole year. What's good to know as well is that the list is ranked based on vulnerability, not time. And so if a person comes off of the list and then they're re-added today, they would be on that list based on their vulnerability criteria. And so it's not as though they would come off a waiting list and then have to wait, months again. It's just depending on their vulnerability criteria. Or if the other option is if a person wants to be removed from the list and would want to not be on that list anymore, in which case they can be removed.
Okay.
Good question.
And then how would they make sure they stay on the list? So say you have someone staying at their storage unit and they don't have a phone. If they make the effort to call into 211, can they just connect and then stay on the list? Just say, here's where I am, etc. Or how do they stay on
Yes.
the list?
Yes, they're welcome to do that. They're also welcome to have you reach out as their advocate and email us and let us know. When we're looking for if that person has interacted with us, we're looking if they've interacted with the whole system. So we would see, if they've called 211, if they've interacted with some of our outreach teams, we're able to see that all within our database. So yes, they're welcome to do that to let us know that they're still in need.
Okay, and so you're in the HMIS database, and so say, Mr. Jones, you hear from me, so you're like, okay, he's at this storage unit. This is the last that we heard from him. This is our last
Mhm.
phone number for him. Deanna's a good contact for him. Is that right? So you put that
Mhm.
in the HMIS? Okay,
Mhm.
thank you.
And then Claude, yes, we can have opportunities for further conversation as well. Awesome. Thank you. Okay. Keep moving here. So, I always like to talk about who we are so that you don't feel like you're referring into a void. So you can get a grip of what our team looks like and what we have available. I always like to think of it as sort of like front of house and back of house. So front of house is fairly client and public facing. Think of it sort of like as if we're putting on a play. Front of house is the actors, and then back of house is like technical theater, stage management, things like that, to help with the logistics and making sure everything runs smoothly. So myself, I am the CE manager, so I help to facilitate the day-to-day of the coordinated entry system. We have an emergency housing facilitator that's there to facilitate shelter placement every day on that call, as well as safe haven placement. We have a data specialist that is more back of house that helps us with all of the data that we are collecting, as well as prepping for our housing staffings, what happened last time, things like that. We have a health systems liaison that helps us to target that intersect between healthcare and housing, and is sort of that mobile screening and assessor between those systems, as well as facilitating that relationship. We have a housing navigator that works across programs throughout the housing process. So facilitating applications, connections with landlords, with that permanent housing as that ultimate goal. We have an intake specialist that's there to sort of be that front line over the phone and connect with people to the further on the coordinated entry system. The intake specialist is sort of like that front door and can pass along to other parts of the coordinated entry team. We have a mobile screener that does in-person assessments and is there at our inReach sites to be able to be in person and connect people to the coordinated entry system. And then we have a prevention navigator who's there to work with people who are experiencing category 2 homelessness and work towards preventing their housing crises if at all possible. So that's who we are. So after you pass the ball, these might be some of the individuals that you're working with to be able to connect further on in the system. Okay, so we have sort of a walkthrough example and can talk through a little bit about what this might look like. You may interact with individuals very frequently in this situation, and so this might be helpful for us in further conversation. So let's consider that we have Anita, who is a single female staying with her cousin, has some pressure to leave. She's reporting that she needs shelter. So she interacted with Maximus W2. Maximus W2 did their assessment and are working on some resources there. She's already attempted some prevention resources and finds she doesn't qualify. And so they've attempted those, and then they were like, you should really connect with coordinated entry. So they've sent an email referral into us. After that happens, because we saw, that Maximus W2 put in that person is staying with their cousin. We know that they're experiencing category 2 homelessness. So we send it along to our prevention navigator, and our prevention navigator does an assessment and provides our prevention line for follow-up while that person is waiting for assignment. After that assessment is completed, it's added to our prevention staffing, which happens weekly. Say we go to the prevention staffing and we're there with Cathedral Center prevention, guest house prevention, and all the other prevention providers that interact with us in that staffing. And Anita comes up for case management. She comes up for guest house prevention. So we send a referral to guest house prevention. They work on the navigation, they pay the deposit, and then Anita moves into housing. So this is just sort of a potential example of how this would work. There are times when a person, might come to our system, they find other resources outside of it and are housed externally, which is also great. And then this is just sort of a common type of interaction that might happen for people you're working with. There is also times too where a person might, she might be staying with her cousin, but then her cousin kicks her out in 2 days. And so we need to be engaging the outreach and shelter process instead. But it just sort of depends where that person is right now and what they want. That's what a lot of housing comes down to. Pause there again for questions. Can we get the name and contact info for the liaison in the hospital? So our liaison is across all of the hospital and the federally qualified health centers. But we can talk more about that and what that looks like in our separate conversation, Deanna.
I
Okay.
have a question. This is Ravel.
Yeah.
Hi.
Hello.
Hi. So I want to know, so I see you say that Maximus W2 sends email referrals. Now, are they the only W2 agency that sends over referrals, just like UMOS or any other W2 agencies send over referrals?
No, yeah, that's a good question. They are not, all W2 agencies are welcome to send an email referrals to us. And if you are finding that your agency does not have a referral process with us and you'd like one, I'll have my email at the end of the presentation as well. And so let's connect about how best to get you looped in. But that's a really good question. Those are all eligible to send in referrals to us.
Okay, I'm with community advocates, but not W2. I was just wondering if the other agencies, if they had a process too. So thank
For
you.
sure. Yeah, no, thank you. What other questions might we have right now? Great. We'll keep going, but feel free to keep adding those into the chat as we go, and we'll keep pausing for it. So now we are at sort of the central point coordinated entry is to be able to collect lots of data with everyone that our system is interacting with. But what is it being used for? What is the bigger picture and what are we using this data for in our decision making and our sort of systems progress? So we have different sub initiatives towards ending different types of homelessness. And that's really where we're using a lot of that key data and collaborating really heavily with the continuum of care on how best to use this data and how best to use our resources moving forward. So our chronic initiative is, again, there to work with our people experiencing chronic homelessness. Chronic by the HUD definition is 12 or more months of literal homelessness documented either in one episode or 4 or more episodes, plus a disruptive disabling condition in the household. So we have a weekly meeting where we talk about people experiencing chronic homelessness and are there to sort of provide resources. But the broader chronic initiative is working towards what systemic resources do we need? What do we need collectively to be able to resolve this and provide housing to everyone experiencing chronic homelessness. So we're abiding by the criteria set out by the United States Interagency Council on Homelessness. They set out criteria for ending different types of homelessness. And so for that reason, we are prioritizing those experiencing chronic homelessness for permanent supportive housing. And once we've ended that type of homelessness, we can move down in the prioritization criteria. So right now, something that we're working on as that initiative is creative solutions for those that have declined multiple housing options, so that we can have different tools in our toolbox to house those individuals in housing that they want. We have a family initiative also that is partnering with the Safe and Stable Homes Initiative at United Way. This initiative began as sort of the operationalization for prioritization criteria and has sort of morphed into this body that's abiding by the United States Interagency Council on Homelessness criteria on our goals to be able to end family homelessness within our community. Our goals are that when families experience homelessness, it's brief, one time, and then there are resources to swiftly meet those needs. And then we also have to have a sustainability plan. So we can't just end family homelessness in one day and then not do anything about it or have a system of resources following that. It's also required that we use coordinated entry and prevention to be able to abide by our goals and say that we've ended family homelessness. We have a youth initiative that recently had a data dashboard created by our partners at the Institute for Community Alliances. Thank you, ICA, for all your help with all of our data. And this matters because there are particular funding sources for youth housing. We've sort of reignited this and we're reinvigorating after a little bit of a hiatus. And so we're really excited to be partnering really heavily with the Continuum of Care as well as Pathfinders and Walker's Point for this initiative. We have a veterans initiative that's targeted towards veterans experiencing homelessness. In this space as well, we have a data dashboard and we're taking a look at the usage criteria and the connection to the Continuum of Care to be able to see how we can best use resources in this space. I've talked a little bit about our health systems integration, but with the addition of the health systems liaison position, we are there to work with the Milwaukee Healthcare Partnership and integrate with all of our hospitals and the 5 federally qualified health centers to have a referral process so that once a person presents into a health system, they can then get looped into the housing resources as well. It's a great identification partnership, as well as trying to see how best we can harness what other funding resources are out there for people within that intersect of that Venn diagram. So we are using this data for further systems asks and services, as well as further housing stock, because we know that no one agency can do this alone. We have to do this together. And so that's a lot of what we're using this data for in our bigger picture conversations. Once again, if your organization does not have a process with coordinated entry, or if you are very curious about anything that I've said in this space, you can feel free to reach out to me and we can have a deeper conversation. If you want to just talk about permanent supportive housing or prevention or staffings, what they look like, things like that, we can absolutely have a deeper dive there to be able to connect about that. So I'll pause there. I'll also put my email in the chat and we'll have space for more questions. We'll pave this and then we'll get to that question. Okay, so I see, do you ever share the data with everyone? How many called? How many went into different programs previous to homeless? So we do have macro meetings where we're sharing that information and taking a look at, it depends, there are specific deviations depending on subpopulation. But yes, we do have spaces where we're taking a look at that. And if you're interested in getting engaged in those macro spaces, feel free to reach out to me and let's get you connected where you need to be. We also have a lot of information sharing with the Continuum of Care itself. And so there also are opportunities for that data sharing to happen in that way. Excellent. Okay. Sounds like we've got a lot to talk about. So that's going to be really exciting. Yay. What other questions might we have right now?
Are there any plans to update the VI SPDAT or change that screening?
So there has been sort of nationally and in a lot of communities, there have been conversations about moving away from the VI SPDAT. We have had conversations about that, but it's not very far along. So we don't anticipate that change anytime soon. But if that's something that you're interested in talking more about or sharing your feedback on, let us know. So no, it's not far along in that conversation, but we have thought about it, and it has been brought up in certain spaces. See a hand. Lisa.
Hey, good morning. I'm wondering about this may be a little too deep, but when people need to transfer out of PSH into another PSH program, are they sent to the top of the prioritization list, or do they re-enter back, in their vulnerability score currently? Do you see what I mean? Like,
do.
how do we do that?
Yeah, so the way that happens right now is through the transfer queue and the second intervention meeting. And yes, we are prioritizing people who have transferred because, if they entered into permanent housing, then they were chronic anyway. And so maintain that chronicity and need for prioritization. And so that's sort of the space where that conversation is had. Whether that's, moving to a different master lease option or a different supportive housing option, or whether it's sort of a move on and a step down to like Section 8 or something like that. But yes, that is part of the prioritization criteria, and they do.
So then it
shoot to the
becomes
top.
possible that some PSH are getting mostly transfers because we have so few PSH slots. So we're sort of recycling folks that aren't doing very well in one PSH to another PSH. I'm just wondering how it all ends up working.
Well, so I mean, there are some individuals that move in and move to a different one and do that repeatedly. And that's okay. We want people to be in a housing option that they want to be in. So there's not a limit on the number of transfers that a person can do. I think systemically, we need more different types of permanent supportive housing options, which is why we're having those conversations of like, what new resources do we need? What new resources are people asking for? How can we direct funding in the best way to be as creative as we possibly can? But those are definitely conversations that we're having with the chronic initiative specifically, because you're right that we're seeing that a lot with our PSH population, is that people are very high need and are asking for different housing options that don't necessarily exist within our system.
Great, yeah, I'm all for more safe haven housing.
We're also, I feel like we're all in the habit of not having more answers, just more questions, but hopefully those deeper questions, definitely lead to help with our service provision and targeting things in a strategic way. So I appreciate that. Thank you. I do have one final slide with just some frequently asked questions, and that might help to clarify some things as well. So frequently asked questions that we do receive. So one, how do I refer in? If you don't yet have a process, feel free to reach out to me and we'd be happy to figure out the best way for you to tap into this resource. Where do I connect with your team in person? So our InReach sites right now, we have solidified Mondays, Wednesdays, and Fridays. We are at Repairs at the Breach in the morning from 9 a.m. to 11 a.m. And we are at St. Ben's in the afternoons, Mondays, Wednesdays, and Fridays from 1 p.m. to 3 p.m. We also have InReach at Silver Spring Neighborhood Center, but we'll be able to send out a little bit more of the specifics of what those dates are. And we're working towards getting InReach at a Southside location as well, because we're finding that we have a very solid downtown presence, but are missing a little bit of our population on the south and north sides. Another frequently asked question is, what are the other continuums of care within Wisconsin? So in Wisconsin, there is Milwaukee, Dane, Racine, and everybody else, which is called the balance of state. And in the balance of state, each one has sort of their local continua. And so if you're engaging with someone who's outside of the county, we can direct you sort of to the best person to start with to engage with their coordinated entry system or their continuum of care. What can we do to end homelessness? Collaboration, more housing systems change, and then engagement with services. No one agency can do it alone. So we all have to work together to work towards ending homelessness in all populations. And then what is the connection to street outreach teams? So we have 3 outreach teams that go out each weeknight to engage with people who are staying outside. We refer frequently to those teams for them to be able to reach out and engage and provide resources. We ourselves in Coordinated Entry don't have our own outreach team, but we connect really frequently to the ones that exist, and we super appreciate their work and their collaboration with us. We couldn't do the job that we do without them as well. Those are some frequently asked questions that we have at presentations. And then, yes, of course, I can give that to you, Ravel. Thank you. I saw that you had texted me too, so I'll send that over to you. Final questions or thoughts? Stop sharing for now. Problem. Okay. Well, thank you all for coming today. This has been recorded, so we'll send it out as well and figure out the technological part of that. But we appreciate you coming.